This was the primary analysis of our LCMC3 trial. It is the largest checkpoint inhibitor as a monotherapy approach in the resectable non-small cell lung cancer population. This is a study where we brought atezolizumab and patients with stages 1B to 3A and selected 3B patients received 2 cycles of atezolizumab, which is a checkpoint inhibitor, and then followed up with surgery and had the option in the adjuvant setting to receive up to 12 months of adjuvant atezolizumab. In this trial, we saw a 21% major pathologic response and a 7% complete pathologic response, and the study successfully met its primary endpoint, which is pathologic regression. I think that what was most remarkable about this is that patients were able to undergo resection in a short time frame from the completion of atezolizumab. As early as 8 days from completion of atezo, patients were allowed to go to surgery, and the protocol window for surgery was approximately 20 days, and 88%, majority of the patients were able to go onto their resection in a timely fashion after atezolizumab, which is quite different from historical neoadjuvant chemotherapy trials where patients were going to surgery much later, often at about 3 weeks out from completion of chemotherapy. And the window is much wider, up to about 56 days from completion of chemotherapy. So the immunotherapy was well tolerated. There was the serious adverse events, serious treatment or immune-related adverse events were quite uncommon. Most of the time it was under 11% or in the single digits, so very well tolerated. And the mortality rates following surgery were superior to expected historical data. It was 0.6% in the first 30 days and an additional 0.6% from 30 to 90 days from resection. And finally, majority of the patients were able to have a minimally invasive operation with either a thoracoscopic or a VATS approach or a robotic approach. And this resulted in a completeness of resection, what we call an R0 resection rate of 92%, which is, again, comparable, if not superior, to expected neoadjuvant chemotherapy trials.